What is an emergency room copayment for health insurance? Imagine needing urgent medical help and rushing to the emergency room. One thing you might wonder is how much you'll need to pay out of pocket at that moment. That's where an emergency room copayment comes into play. It is a fixed dollar amount that your health insurance plan requires you to pay when you visit the emergency room for urgent care. This fee is set by your insurance policy and is usually paid at the time of your visit, no matter how high the total bill might be. For example, if your plan has a $100 copayment for emergency room visits, you pay that amount right then, even if the actual charges from the hospital are much higher. The copayment is a specific, predetermined amount, not a percentage of the total bill. It stays the same whether your emergency care is minor or severe. It is important to know that this copay is generally separate from your deductible, which is the amount you pay out of pocket before your insurance starts sharing costs. Some insurance plans might requiring you to pay the deductible first before copays apply, or they might charge copays along with coinsurance after the deductible is met. Copayments are part of what is called cost sharing, meaning you share some of the costs of your healthcare with your insurance company. Besides copays, other forms of cost sharing include deductibles and coinsurance, which is a percentage of the costs you pay after the deductible is met. Payments made as copays usually count toward your annual out-of-pocket maximum, which is the most you will pay in a year for covered services. Once you reach this maximum, your insurance generally covers all additional costs for covered treatments. It's also worth noting that not all health insurance plans have copayments, and the amount can vary widely depending on your specific plan. Some plans might have higher copays for emergency room visits compared to regular doctor visits or urgent care. Typically, you pay the copay either at the time of service or shortly after, which is different from coinsurance that might be billed later after your insurance processes the claim. Knowing your copayment amount helps you prepare financially for emergencies. It's a good idea to review your insurance policy to understand how much you might owe if you need emergency care, how it interacts with your deductible and coinsurance, and whether you pay the copay immediately. This knowledge can help you plan your healthcare expenses and avoid surprises when urgent care is needed. In summary, an emergency room copayment is a set fee you pay for emergency services under your health insurance plan. It helps share the cost of urgent care between you and your insurer, providing a predictable expense while ensuring access to emergency services when needed. Always remember to check your specific policy details and consult healthcare professionals for personalized advice.